The relationship between the black community and the American healthcare system has always been questionable. Throughout this presentation, we will explore the relationship and solutions that could improve it. Like many issues surrounding the black community, this too is rooted in slavery. Not only is it an issue of race, but also of class as well. Here we have a few notable events that have shaped the relationship between black people and the healthcare system. Smallpox experiment. While conducting her research, science history professor Londa Scheinberger found that antebellum doctors would conduct unnecessarily dangerous experiments on slaves. In this case, it was John Quier and 850 slaves being used to test smallpox vaccine. Sarah Bartram. Exploited in the name of science and research, doctors use her to make assumptions on the sexuality of black women. Her remains were also put on display in a museum for a number of years after her passing. J. Marion Sims. Known as the father of modern gynecology, he is also a very controversial historical figure due to major ethical issues. Tuskegee syphilis experiment. This was a 40-year experiment conducted by the United States government. This experiment involved almost 400 black men who were denied effective treatment for the disease so that the documentation of the disease would be examined. As a result of racism and sexism that black people have experienced, it is easy to see that there is a terrible relationship between them and the healthcare system. The government plays a huge role in the way black people handle their healthcare. Sometimes it is simply too expensive or just inaccessible due to a number of reasons. An example of this would be where they live and what type of healthcare coverage is available in their area. A few factors in the person blame approach when dealing with this subject matter include lack of education on the healthcare, stigma, and cultural norms. Black people are typically less likely to go to the hospital unless it seems like a life or death situation. Here are a few statistics associated with African Americans when it comes to healthcare. The CDC says that 11.5 blacks under the age of 65 have no health care coverage, and 13.5 blacks report their health as fair to poor. There are many things to consider on this chart, but I took the most important numbers for the sake of time. Here is the breakdown. Young blacks face more healthcare challenges compared to their white counterparts, and they are more likely to be uninsured than their white counterparts. The solution to this issue starts with black people gaining a sense of trust with healthcare professionals and the system. It also would help if the government made healthcare more affordable and accessible for black people.